This talk that he's going to give tonight is a real departure and a real treat, I think, for all of us. So I think without giving any more away, Dr. Camarata, I'm going to turn it over to you.
This is a story that I have to thank my wife for, first of all, for sleuthing, as Rick mentioned, and doing a fair amount of the background work, and also Jason Gora, our research coordinator in neurosurgery, who helped me tremendously. And it's the story of a Kansas connection to a Missouri man who is arguably the greatest neurosurgeon the world has ever known, certainly perhaps the greatest American neurosurgeon. It's the story of two lives that crossed in the early part of the 20th century, so 100 years ago. One, a remarkably famous man from Missouri, the other, a remarkable and not so famous woman from rural Kansas. And it began as an attempt to solve a mystery that I found. What were these strange ancient boxes doing in my office when I moved to KU 3 years ago in Sudler, and to whom did they belong? So Walter Dandy, as many of you may already know, is a world-renowned neurosurgeon who has a tremendous number of feathers in his cap. He described the blood supply while still in medical school and nerve supply to the pituitary gland. He published papers on the production, circulation, and absorption of CSF, really the seminal description of how CSF is formed and circulated in animal experiments and later with humans. Potential treatments for hydrocephalus. He published a landmark paper on pneumoencephalography, which got him nominated for a Nobel Prize in medicine. This is the infamous pneumo chair. Does anybody in the crowd remember this or has seen one of these? Probably a few people, yeah. Was not a pleasant experience, okay? This was how Dandy really revolutionized at the time the treatment of neurosurgery and neurology by localizing mass lesions in the brain. For the residents, I think you know this, it was injecting air into the lumbar theca and then turning the patient in all kinds of various contortions to get that air to outline the ventricles and by inference then decide where mass lesions were. When I was at KU as a med student, Dr. Brackett said there was a pneumo chair still at KU. I'm not sure if it still exists. Lillian, you think it does? Maybe it does, yeah. So again, Dandy was nominated for the Nobel Prize for that. In 1921, first removal of pineals of tumors in the pineal region. These are all firsts. Complete removal of tumors of the cerebellopontine angle in 1922, almost 100 years ago. Again, Dandy stressing completely removing these, not just biopsying them and getting out. The use of the endoscope for ventriculoscopy and hydrocephalus. Recuse, you think you're new with the endoscope. He was doing this 100 years ago with a cystoscope stuck into the occipital horns, coagulating the choroid plexus for hydrocephalus. Dandy was the first. The sectioning of the trigeminal nerve for tic douloureux. I mean, you name it. Sectioning the eighth nerve for Meniere's disease. Removal of herniated discs in 1929, I think that says. And he went on to perform over 2,000 of those operations, discectomies. I believe it was 1919 when he was sidelined. The only time he was really sick in his life was sidelined for 6 months with sciatica, and went on to figure out what caused it and then treat it in 2,000 patients. The treatment of spasmodic torticollis in 1930, and so many more things. The first hemispherectomy for tumor, removal of intraventricular tumor, treatment of a CC fistula. For those of us in cerebrovascular neurosurgery, the first clipping of a posterior communicating artery aneurysm. Dandy was the first in 1937, and removal of orbital tumors through the brain or intracranially. Just really a giant of a man. So why are we talking about Dandy tonight and his relationship to the University of Kansas? Well, it all started here at the KU Medical Center complex in Paul's Sudler office that you see there. When I moved there, and what is this ancient moldy box sitting in the bottom of my bookshelf, and right next to it, a sort of textile, leather-bound book with a number of articles and sketches in it. And I thought, all right, I'm going to look back to some of my my previous predecessors in neurosurgery. Bell Memorial Hospital was built on land donated by Mr. Bell in honor of his wife in 1905, I think it says. Frank Teachner graduated from medical school at the University of Kansas in 1911. This mugshot still hanging on the wall on the first floor of the administration building. I think this says Teachner describes, actually took a 10-week course, crash course in neurosurgery with Charles Frazier at the University of Pennsylvania. That's how he learned his neurosurgery. Back in those days, neurosurgeons were general surgeons first, of course, and he took a 10-week course. This is, of course, at the time of Dandy was at Johns Hopkins, and I'll talk about that in a little bit. But Frank Teachner spent 10 weeks learning neurosurgery and then set up the first practice of neurosurgery west of the Mississippi River. He was in the medical corps in Limoges, France in World War I, Captain Frank Teachner. He set up the first practice, as I mentioned. Here's an article from the Archives of Surgery on Annals of Surgery on pneumocephalus, traumatic pneumocephalus. He joined the KU faculty in 1924. Here you see him present at the founding of the Harvey Cushing Society, which is the now called the American Association of Neurological Surgeons. He was one of the 32 founding members. Don Coburn joined Teachner in practice as well in Kansas City, and Teachner was named chair at the University of Kansas. Here you see Teachner as the president of the Harvey Cushing Society, sitting at the right hand of Harvey Cushing himself at his 70th birthday party. So there's Frank Teachner, and I thought, could these have belonged to Frank Teachner? I mean, it's possible. They were from the early 1920s and 1930s. There's, of course, no way to track that down. There were no telltale signs that they belonged to him, and Teachner's family is long gone. Frank is buried at, I believe, the cemetery here on Troost in Kansas City, along with his wife and son. W.P. Williamson succeeded Dr. Teachner as head of neurosurgery, and I thought, well, these could be Dr. Williamson's diagrams or sketches that I found. Charlie Brackett joined the faculty as well from the Neurological Institute at Columbia and joined W.P. Williamson. Williamson received the first Jayhawker MD award. Teachner died here at age 65. There are some Teachner lectureships. We don't need to get into that, but this you can find this on the KU Neurosurgery website. Suffice it to say, the next chair, Dr. Charlie Brackett, is still alive. Dr. Brackett is over 90 years old now, and I specifically visited him with these diagrams and said, Charlie, do you have any idea what these are? These were in your office, which became my office. I said, could these be Dr. Teachner's? He said, no, Teachner wasn't that sophisticated, or something like that. Yeah, he wasn't doing surgery like that, Paul. But are they yours? No, he had no clue why they were there, and denied ownership. Paul Oboynik became the chair following Dr. Brackett in 1987, and Paul similarly had no clue where these things were. My hunch is they were sitting on this shelf under a pile of books for probably 50 years in the same office. Once again, we're back to the box and who it belonged to. Inside the box, and the box, mind you, is falling apart. This is over 100 years old, or about 100 years old. I see these manila envelopes, and there must be 40 of them in there. Dural endothelioma, Mrs. Barchis, that's a HIPAA violation, I'm sorry, July 28th, 1923. Okay, dural endothelioma meningioma, okay, is what it's known as now. And you see it right here with this really elegant charcoal sketch, surgical instruments there. You can see how the bone was opened with holes placed, and then a Gigli saw going around. And at the top right-hand corner of each of these envelopes, Sybil S. McDonald Dell, D-E-L. Presumably this is either who they belong to or who did them. Does anybody know what D-E-L means? I didn't either. And so I went to Google and said, what does DEL mean? I have a series of watercolors. The artist signed them, etc. What does DEL stand for? Somebody says. The answer is delineavit. It is Latin, the imperfect form of Latin, meaning he or she drew it. Okay, so we now know that Sybil MacDonald is the artist responsible for these diagrams. Now, inside this little book, this bound book, are a number of sketches, and first of all, in the very first pages, some newspaper clippings. Famed surgeon dies. This from 1946. Walter Dandy from Sedalia, internationally known brain surgeon. Where he had performed his greatest work in Baltimore, he was 60 years old. So whatever this book is, at least some parts of the book were put together after 1946. It mentions in the article cutting the auditory nerve in half, affecting a permanent cure with almost no risk and no after effects. He lost 1 out of 400. In 1940, Dandy reported 401 operations with this technique, 400 cures, and 1 death. So pretty amazing. Although, Charlie, you probably would debate the 400 cures for vestibular disease by cutting the vestibular nerve. But this is what Dandy claimed. Known as a daring and skillful man with a scalpel, Dandy frequently brushed aside long cherished notions on operative technique. In 1930, he said almost 2/3 of a man's brain might be cut away without damaging the intellectual powers. Proving his point, he removed both frontal lobes of one patient's brain. The patient recovered completely. So, needless to say, Walter Dandy was a man, the myth, and the legend. But he certainly was a great neurosurgeon, and you'll see that throughout the presentation. So in this book, these sketches, obviously a cadaveric head in sections, the inside of a skull, all kinds of other very elegant sketches made in charcoal with colors, the facial nerve and its branches, the trigeminal nerve and its branches, the section of the head here. So this is presumably Sybil MacDonald drawing these sketches, these anatomical specimens. And again, they're very elegant, something you would see in, Max Brodell's work from Hopkins or Frank Netter, even, one would say perhaps even finer. The arteries of the brain and the circle of Willis, and she makes little notations to herself in many of these diagrams. Here's a mid-sagittal section of the head with the spine. So not always pathology, sometimes anatomy. Here we have the canine anatomy, because Dandy was working on CSF circulation at the time, and also innervation and the blood supply to the pituitary gland. And here she is drawing dogs, the canine brain as well. See with the Sylvian fissure also located and diagrammed. This is a notation about ventriculography, and talking about the visualization of the ventricular system. This work, appropriate location from ventricular puncture and position of the head. So she's writing basically what Dandy is discovering and describing in the literature for the first time, the ventriculography. And then I see this, autopsies, with a number of patients. Many of these patients, actually, their names listed on the manila envelopes that I found, along with dates here. Again, a HIPAA violation. Notes on Dandy reprints. So now we know that this woman at some point was with Dandy, working with Dandy, and she mentions a number of his reprints. She talks about the aqueduct of Sylvius, operative wound on the left, Rolandic area extending to temporal, filling like pus. This is an autopsy conference, Monday, October 10th, 1923. So we have some dates now. Again, operative exposure, and she lists a number of diagrams, assorted vessels. Finally, let's see, draw vein in the Sylvian fissure, operative exposure, July 31st, 1923, Solomon. So she's keeping notes to herself on what she is doing for Dr. Dandy. Here's the the outline for a cerebellar incision. And this is, of course, the way that you used to operate on the back part of the brain, acoustic neuromas, cerebellar tumors. Some people still do. A big T incision, and you see the incisions here. Do you guys, residents, know what that's for, these little incisions here? Burr holes, yeah, the dandy hole, exactly. Dr. Hilton mentioned we still call it the dandy hole to relieve CSF pressure. So finally, I see a page that says list of drawings to be made for Dr. Dandy. So now we see that this is truly Dandy's illustrator, and she makes a number of notations, the operative condition, tumor in, etc., up to the tentorium, hypophyseal operation in dogs, and many of those illustrations we have. So then I once again, with the help of my wife, turned to Google Sybil McDonald. What else do we do in this day and age when you're trying to find somebody? Who is Sybil McDonald? And I came up with this. In Lawrence, in the Rare Books Library there, the Spencer Library, there is a book that can be searched online called Evolution of an Entomologist by Sybil S. McDonald. Could this be the same person? Why is an entomologist working for Dr. Dandy? So my wife and I actually made a trek over to Lawrence one afternoon. We actually found Sybil Betts, which was her name at the time, in the Jayhawker yearbook. Here she is, known as Betsy, was in the Glee Club, mentions some other things when she graduated from KU with a degree in botany, or in entomology, sorry. In her autobiography, which is there, which is over 100 typewritten, double-spaced pages in this Rare Books Library, we see that she was born in 1887 from Lawrence. Her maiden name was Betts. She was the granddaughter of someone named James Grinter. Moses Grinter was the first white settler of Wyandotte County, so somewhat distinguished pedigree for Sybil. She was an artist for the state entomologist, graduated with a BA at KU in 1909, 2 years before Teachner graduated in 1911, and moved to Chicago to the Art Institute. That was one of the first things she did upon graduating. And from her memoirs, she says, "My father died at the end of the next fall term." This was when she was still at KU. "He had insured himself for $1,000 to me to finish my education." She was the only child. "My mother borrowed $400 of that to complete the down payment on a large 10-room house at Lawrence, and I filled it with girl roomers. I did all the financial arrangements, paid all the bills, even rented the piano for practice. I had begun the study of entomology. My mother considered this a waste of time." And so a very interesting thing. My father was Sicilian, and in the Italian culture, males are kind of rule. And I had 3 sisters and 3 boys, and my dad took out insurance policies on the boys and nothing on the girls. Figured, well, the girls will marry and get taken care of. This is just kind of the way they think. But back in this day, she really she got an insurance policy on her from her forward-thinking father to see her through school. When she moves to Chicago, this is the old Bell Memorial Hospital, by the way, living at the YMCA on Michigan Avenue, attending the Art Institute, which is still there, a very famous institute in Chicago, worked at the University of Chicago, came back home for Christmas looking for work. I climbed the snow-covered hill to the University of Kansas Hospital and Laboratory and walked to the dean. Surely they needed an artist. Dr. Hertzler was writing a book on tumors and cancers. He was spending $5,000 to establish a medical library instead of buying a car. This here is the famous Dr. Hertzler, who was famous for his horse and buggy doctor book. This is a picture from Dodge City in the 1930s. She says, "I was surprised by his appearance, a very Lincoln-esque type, tall, bony, rumpled, big glasses over sharp black eyes, dark skin, ancient, or looked to be." We settled the pay to be $50 a month. So I settled down to a cheap kitchen table with a drawer by a north window, and the first specimen was fished out of a jar and put on a green tray. The formalin preservative was so strong I almost strangled. I must cover the chunk anytime I let it and put it in the jar at night. He sat at a table on the other side of the room translating Italian incommunicato. So here we learned that Dr. Hertzler spoke Italian. So that was Sybil McDonald, and that was going on in Kansas City at the University of Kansas Hospital at that time. Simultaneously, in Sedalia, Missouri, only a few hours away. Walter Dandy was being raised and going to school. Dandy was born in 1886 in Sedalia, Missouri, to immigrants from Ireland and England. He was the only son of the Dandys, educated in Sedalia. His father was a railroad engineer, so Dandy loved trains throughout his life. Here is dapper Dandy with a cap. Here he is with his mother and father. This is the school that he attended in Sedalia, Missouri. Once graduated, he moved to Columbia and attended the University of Missouri. And some of you who know the Columbia surrounds may notice some of these locations and know where they are. This is Dandy right here with some of his buddies when he was going to school. Dandy is, I think, right here, right in the center, and you see sort of a canyon behind him with a river basin, and here's some rocks. Dandy is right there again with some of his colleagues. He was there at Columbia that he met Harry Orr, as well as Eustace Sims. Eustace Sims, a famous neurosurgeon who set up the Sims-Murphy Clinic exactly with Francis Murphy in Tennessee. Dandy was a Rhodes Scholar. He actually got a scholarship to go to England, but was told that there is no medicine at Oxford, or at least you cannot use this scholarship to study medicine at the time, so he had to give it up. And he graduated in only 3 years and then went off to Johns Hopkins Medical School. So back now to Sybil McDonald. Sybil got married to Eugene Swegman, had a daughter, Eugenie, or Gina, and another daughter born in 1916 named Rosemary. This is somewhat important. Rosemary got critically ill, she says, convulsions as often as 3 a day. No one seemed to know what it was. Back home it continued 3 weeks, and the child specialist insisted I put her in Mercy Hospital. So this is 1916. There she lay 13 weeks, got down to 9 pounds in weight, no sight, limbs paralyzed, heels drawn under and stiff. Dr. Hunt, the best pediatrician in Kansas City, would care for her. And I imagine those of you from Children's Mercy might know who this Dr. Hunt was, or at least there must be something over there, some records on him. So Sybil, after working at the University of Kansas for a while, gets a job in Washington, D.C. at the Bureau of Entomology, Department of Agriculture. Of course, she draws insects. And there are a number of diagrams that she drew, insects that I actually located in some of the literature from the School of Entomology, the zoology department at KU. She mentions Rosemary, again from her autobiography, walked when she was 5. She limped. She used her right leg like a pane or a peg or a cane. The x-ray man of public health had her head x-rayed, and the tumor showed up. I sent the x-ray to Dr. Hertzler. He said it could be removed by operation. One Monday, I took her to Johns Hopkins Hospital to an appointment with the brain surgeon, Walter Dandy. So now we see how the connection is finally made. Dandy had been at Johns Hopkins after attending medical school there for 4 years, working in the Hunterian laboratory and working under Dr. William Halstead for several years already. Dandy was the surgeon at Johns Hopkins. This was after Cushing had left. He arranged for the operation the next morning at 8 a.m. Just as the operation was at the critical stage, I got a long-distance call from Washington. She died of shock while I was away at the front office. Tumor weighed 720 grams, was a teratoma occupying almost the entire hemisphere. There was no hope. She was only 6.5 years old. I allowed him to autopsy, and he kindly advised me to bury her in Baltimore and not take her home. So what happens next? It is a terrible shock to be suddenly left without the anxious watchfulness of such a child, someone that she had cared for many, many years now, 8 years. 1923, Dr. Dandy asked me to come to Hopkins and train to be his artist. He bore all expenses, gave me $50 a month while training, and $125 after that. At Baltimore, I dissected in the morning, drew in the afternoon. The work was very precise, very scientific. In the summer, I was in the operating room 8 hours a day. Gloria had scarlet fever and an infected tooth, which Dr. Dandy extracted himself. So back to the diagrams that she did that summer and fall of 1923. This is Mr. Baptiste and tuberculoma. Another lesion here in the temporal fossa on the right side. This is the hemangioendothelioma, the meningioma that we saw earlier, another coronal diagram of it here. This is an interesting diagram. This is the spinal accessory nerve being tied, sutured very carefully. You see here Dandy sewing the epineurium together for a facial paralysis case. So Dandy did a lot of posterior fossa tumors. The acoustic neuromas undoubtedly had a significant amount of morbidity involving facial nerve, and here he is sewing the spinal accessory nerve to the facial nerve. Just an exquisite diagram. Here is the diagram before showing that. Here's a posterior fossa lesion. Again, the T-shaped incision, the dural opening, and the cerebellum with the Vermean lesion exposed there. August 14th, bang, left craniotomy, dural endothelioma. This is an additional, very beautiful sketch. Now, back in these days, I think I've told this to the residents, many of these surgeries were staged because of the, there was no electrocautery, or Cushing had just developed electrocautery, but there was certainly no blood transfusion. So they would open the wound, do the holes, open the bone, take the bone off, sometimes maybe even open the dura, and then close the skin and wait a few weeks for the patient to rebuild their hemoglobin back up again. Another beautiful diagram of a cerebellopontine angle tumor that you see right here next to the basilar artery, and how he would approach it. Again, the patient undoubtedly sitting and a retractor placed beside the cerebellum. Here, a third ventricular tumor that you can see with ventricular dilatation. Really exquisite diagrams worthy of any artist that we see today. Here's Dandy on a spinal tumor. This was an epidural tumor surrounding the spinal cord. This is the diagram I have framed here in the front. You can come up and look at these afterwards. Here is the facial nerve anastomosis with the 11th nerve that we just saw. And again, you see the hands of Dandy right there operating on the spine. Here are some of the other diagrams she's made of that particular case, the spinal cord, the dura, etc. Again, this was the time that Dandy was at Johns Hopkins. Dandy was instructed by really the first real neurosurgeon in the United States, Harvey Cushing. Dandy and Cushing had a bit of a falling out. Here you see Cushing, looks like he's been photoshopped here in this photograph with Halstead, Cushing, and associates at Johns Hopkins. Cushing eventually went to the Peter Brent Brigham Hospital in Boston and did not take Dandy with him. So everybody at Hopkins figured that they were going to go together, and a week or so before Dandy was to leave, Cushing was to leave, informed Dandy he wasn't going with him. So there was a rift that had developed between these two that was quite antagonistic for many years. Here they appear jovial playing tennis. One person who witnessed this match said that Cushing had the style, but Dandy won the day and the match. Reportedly, there are all kinds of reasons quoted as to why the two didn't get along. Dandy said that Cushing did not quote his tumors of his removal of the cerebellopontine angle tumor in an article when he was reviewing this. I believe that Cushing claimed that Dandy did not quote his previous article, and you can imagine how difficult it was be. And now we just get on Google or PubMed and we can see everybody's articles, but to know who published what at what time, etc. There was the famous quote that when they were operating together, Dandy reached in to do something with his left hand, and Cushing said, come on, Dandy, use your right hand. You're bad enough with it, At any rate, Cushing moved on. Dandy was left at Hopkins, and that is really where he made his mark. Halstead wrote to William Osler at the time, "Dandy will go far." He recognized the talent. Like most of the best products of Johns Hopkins Hospital, he comes from the West. So in this, curiously, in the autumn of the year that Sybil was working for Walter Dandy, Dandy met Sadie Martin, who was to be his wife. He embarked on a European tour that December, was there for several months, writing to her nearly daily, and they married the next October. And then he went on, of course, to an amazing neurosurgical career. These are Dandy and colleagues. This is Dandy down here at Hopkins. There's Walter Dandy on his bicycle. He was somewhat of a sportsman. This is a helmet that a baseball helmet. Dandy actually was the first to describe the baseball helmet. And actually, I believe it was Larry. So at this time, I believe it was in 1938, I'm not sure exactly on the date, but a baseball player by the name of Joe Medwick, who played for, among others, St. Louis. He was playing for the Brooklyn Dodgers at the time. Joe Medwick was hit in the head by a fastball, knocked out, unconscious, and nearly died. And he was hospitalized, and it became a national ordeal. Why, we're going to have to do something about this. So Dandy took it upon himself, because he loved baseball, to design the first baseball helmet. It became a family affair. Everybody, Dandy's wife would cut out the pieces of plastic, and they would try and mold it. And he got a patent on this, actually, at the U.S. Patent Office. Larry McPhail, who was the Brooklyn Dodger coach at the time Joe Medwick went down, actually claimed that he had invented the baseball helmet. Dandy sued him, and actually did get won the lawsuit. Joe Medwick is famous for, in addition to being hit, to doing a tour with the USO during World War II and going throughout Europe and showing up in Rome. He was one of several individuals who were given an audience by Pope Pius XII in Rome, and Joe Medwick showed up before him, and upon being asked by the Pope what his vocation was, Medwick replied, "Your Holiness, I am Joe Medwick. I too used to be a cardinal." So that was Dandy and the baseball helmet. Again, Dandy, as I mentioned, was sort of the neurosurgeon, extraordinaire, the man, the myth. He was beyond good. Dandy cures malady that made Luther throw inkwell at Satan. Baltimore brain specialist tells surgeons of operation for relief of Meniere's disease. So he talks about, again, the sectioning of the eighth cranial nerve. Dandy pioneered a shunt that went through the fourth ventricle into the third ventricle. You see the catheter here. And again, that is a diagram. These are all diagrams that we have. This is a herniated disc, obviously, in the lumbar area, showing the dura and the disc herniation. Here you see a diagram of his operation of sectioning the vestibular nerve. So the cerebellum being pulled aside, you see the mastoid process here. The vestibular portion of the eighth nerve, the tentorial half of the nerve you see right there, and a little hook going right through that to cut the nerve and reportedly cure Meniere's disease. He was surgeon to the rich and famous, and almost surgeon to the rich and famous. Dandy operated on this gentleman, Thomas Wolfe, a novelist, died at age 38. Was living in Seattle at the time. Wolfe's parents actually ran a sanitarium for people with tuberculosis in Asheville, North Carolina. Wolfe was at the time living in Seattle and contracted tuberculosis. And he had tuberculosis of the brain, was taken by train at that time from Seattle to Baltimore. Dandy operated, could not save him, and he died at age 38. This is Margaret Mitchell, Gone with the Wind, who was a patient of Dandy's. Actually had a herniated disc and actually became a failed low back patient. And Dandy's wife, Sadie, reported that she was not a kind patient, or a very grateful patient as well. Anybody know who this is? Yeah, George Gershwin. Now, Dandy was called to operate on Gershwin, never actually made it to Los Angeles at the time. Gershwin was 38 years old when he died of a glioblastoma multiforme, and had begun having sort of uncinate fits for a number of months before this. Finally, the call went out to Dandy, who was in Chesapeake Bay on a yacht, and by the time they the Coast Guard sent a clipper to get Dandy, they brought him into Baltimore, flew him to Newark, and were poised to fly him to L.A. This was after Gershwin had become unconscious. And Howard Nafziger was a neurosurgeon who had also trained back on the East Coast, was in Los Angeles at the time. Dr. Nafziger took Gershwin to surgery along with Robert Rand, a famous neurosurgeon at the time, and they were unable, of course, to save Gershwin. They did operate. He never recovered. So Dandy almost operated on him. You may know who this is. Dorothy Lamour, yes, this is Hedy Lamour. It kind of looks like Hedy Lamour. Dorothy Lamour Dorothy's mother was operated on by Dandy. She became a close friend. Here you see some autograph, and also H.L. Mencken, a colleague, and here you see Dandy in the same picture with Mr. Mencken. And Mencken said, "Dear doctor, my very best thanks for that elegant flask of rye. It undoubtedly saved my life. The brethren, you have gotten tired of me and so proposed to ship me off this afternoon. You were indeed kind to drop in on me and cheer me up. I hope we meet again soon after I escape. Yours, H.L. Mencken." Leon Trotsky, who was in asylum in Mexico at the time in 1940 and was assassinated by Stalin's Secret Service and clubbed over the head with an ice pick. And there had been several other attempts at assassination. Trotsky was really on the run. He wasn't given asylum by many countries and finally had to hole up in Mexico for a few years. He was killed, and Dandy was flown down there to operate on him, only to have him die before he was able to operate. So once again, back to Sybil, who in 1923 was working for Dandy, but we learn from her autobiography that she married James MacDonald in December of 1923. Mind you, this is a month after Dandy left for his European tour. And 10 months later, her only son, Walter Dandy MacDonald, is born. She named him after Dandy, curiously. Leave that as it may. In 1926, she moved back to Kansas City to work for KU Medical School. It's awfully interesting that she named her child Walter Dandy MacDonald. Yes, she says in her autobiography, he was dean and tried to take care of everybody. Who was Dr. Wall? Dr. Wall had come from Hopkins along with young Dr. Schmidt to teach anatomy when I was there. I was to eat lunch with the doctors of the hospital to keep up my milk supply for Pat. She had another child. And then Dr. Hellwig drove me down to the old lab building on Seminary to my studio. Seminary is just, right down the hill in Rosedale from KU Medical School. So she returned after Dandy, I surmise, had gone off to Europe on his tour to Kansas City to work at KU Medical Center. There was a fine group of doctors home from the war around. 6 of the faculty members had been classmates at Hopkins. When Dr. Wall had a birthday, we planned to feed and presented him with a new desk pad. I kept and used the old one for years. The point is, I met all of them. So she was really wallowing in the medical legends at KU at the time. This is a little later in her life. She moved and owned 104 homes in her lifetime. I mean, reading this autobiography is literally a trip across the United States. She lived a number of places, bought and sold homes in Washington, D.C. 3 or 4 times, in Baltimore, in Lawrence, in Kansas City, and she lists the addresses. She's writing this autobiography, I think, at about age 86. She lists the addresses of all of these places. Lived in Lawrence, Kansas City, Washington, Michigan. Here I found an article from her in the Topeka Capitol. Kansas mother not meek when she asks general where her boy is. Mrs. Sybil MacDonald of Lawrence spoke for millions of American mothers last Wednesday when she asked Lieutenant General Ennis Whitehead, "Where's my boy?" Turns out her boy Walter was in the war, actually in the Philippines, and this was a year or 2 after the war had ended. He had not come back, and she, real spitfire when you read through this article, how she's confronting the general and asking, where are these kids? Also in the box of drawings, sketches, I found a number of reprints. This is, of course, a very famous reprint, a method for localizing brain tumors in comatose patients, talking about his ventriculography, the thing that almost won him the Nobel Prize, or that got him the nomination, the treatment of brain tumors. Another monograph on certain procedures useful in brain surgery, remarks by Walter Dandy from the Hopkins Bulletin. Localization or elimination of cerebral tumors by ventriculography. All of this in these boxes. And then a box of 4 slide boxes which contained slides, glass slides of pneumoencephalograms. So could these be Dandy's pneumoencephalograms in these boxes? I was able to find the obituary of Sybil MacDonald, who died at age 99. Saturday in 1986. She was born in Edwardsville, lived in this area most of her life. Mrs. MacDonald's had been a medical illustrator for Marquette School of Dentistry, Milwaukee, U.S. Department of Agriculture, Johns Hopkins, etc., the U.S. Navy Hydrographic Service. She was a graduate of the University of Kansas and Johns Hopkins, a member of Grace Presbyterian Church. She leaves 3 daughters, mentions the daughters here. It was one of these daughters that gave me some of the information. And we called one of her daughters, who is still alive, Patricia, in Boston, Massachusetts right now, tells where she's buried. This is her tombstone right here. So dying at the age of 99. So I wondered, again, how did these things get to this office? What did Sybil have to do with KU Neurosurgery? I asked all of the chairmen who were still around. Nobody knew anything about it. Well, going back to her autobiography, I found this sentence. Teachner, or Techner, it doesn't say Teachner, but it's spelled a little differently, whose father was a publisher, checked the drawings I was making for reproductions. A student was doing the microscopic, a lab assistant furnished the labeling, etc. So this is her talking about, I presume, Frank Teachner. Now, I had to find out whether Teachner's father was a publisher. Again, Frank Teachner, 1911, graduate of medical school. She is back at working at KU. And here from the 1900 U.S. Census, which you can find online, we see Frank Teachner living here with his mother and father, who is an engraver. So I truly believe that this perhaps came about. So I believe that these drawings of 1 year of Walter Dandy's surgical procedures were left here by Sybil McDonald, perhaps to an old friend, a friend that she knew in the 1915, 1920 era after Dandy's death in 1940, because we knew Dandy died, and she had the articles, the clippings at that time. They were probably given, my hunch is, to the current chair of neurosurgery at the time, Frank Teachner, who gratefully received them and deposited them on the shelf in Sudler, where they remained undisturbed for nearly 40 years. This again is Teachner here at the meeting of the very first Harvey Cushing Society, what is now the AANS. In this picture, some real giants of neurosurgery: Paul Busey, Eustace Sims, Louise Eisenhart, not a neurosurgeon, but a pathologist who was really Dandy's or Cushing's right-hand woman, written a number of books along with him, a founding member of the society. William German, James Gardner, John Fulton, who wrote Cushing's biography. Let's see, who else is there? Eric Oldberg, Eustace Sims, Glenn Sperling, Frank Teachner, of course, and William P. Van Wagenen. So this really the very first neurosurgeons. And only recently was I able to contact the archivist at Johns Hopkins University, and I gratefully acknowledge their help here and their permission to show this. A letter from Dandy to Frank Teachner dated May 11th, 1926. Dear Dr. Teachner, I'm very sorry to not have answered your letter sooner. I don't have much time. There is nothing about our apparatus which is at all unusual. It is merely I can't read that. Yeah. Handmade apparatus with shoulder pieces and head piece established or attached. And let's see, the thing fits on the end of the table. Possibly this, what does that say? Yeah, degree diagram may give you a little, we don't have the diagram, unfortunately, may give you a little idea. If you will look at the Archives of Surgery this month, you will see a case, is it one of your cases? Yeah, of pneumocephalus. Yours very truly, with kindest regards. And even better, this letter from December 4th, 1928, I believe it says. Dear Dr. Teachner, I've been advised to write you relative to a few talks I am I'm going to give, thank you, at the postgraduate school at the University of Kansas, December 11th or 12th and 13th. So this is in 28. Dandy came here to give 2 lectures. I wonder if it would be possible to get an unlocalized brain tumor of any kind, or a tumor which has not been operated, for the clinic. I do not know when it will occur. If you could have 2 or 3 other cases of any type of neurological condition, spinal cord tumor, tic douloureux, hydrocephalus, and so on, I should be very much indebted to you. I shall look forward to meeting you again, trusting everything is going well with you, and with kindest regards, I am Walter Dandy. So a very cool correspondence to Dandy and Cushing. Now, one other possibility, since I've located these letters, of course, would be that Dandy himself left some of these pictures with Frank Teachner later on. And one final picture I'd like to show you to close out our story, found on the inside cover of the Canvas book, which is Dandy in the OR in surgery with eyes overlooking him that I feel very well may be Sybil McDonald.